LASIK and cataract surgery. Where else but ReVision? I'm Doug Theaker. You're watching I Love My Job. Alyssa's with us. Hi, Alissa.
Hi, Doug.
Fairchild, thank you very much for being on I Love My Job. Obviously, you love your job or you wouldn't be here.
That's true.
Good.
I do love my job.
Okay. And you are, give us your title.
I am the Experiential Administrator at ReVision.
What does that mean?
That means I help create systems and implement systems for the patient experience and the team experience to make it the best place to work and the best place to come for vision care.
Good for you. Congratulations.
Thank you.
What are the services that are offered by ReVision, LASIK and cataract surgery?
Well, we have a group of surgeons and optometrists that specialize in the anterior segment or the very front of the eye. So we can provide general eye care, exams for eye health and prescription. We treat cataracts, we do vision correction procedures, LASIK, PRK, and we also treat dry eye, and we do corneal procedures.
Whoa, that's a lot.
It is a lot.
Well, of course, again, our eyes are very important, obviously, to all of us.
They are. It's our main sense of sensory input, our eyes.
Wow, that's
ReVision.
Ooh. How long has ReVision been in the community?
Dr. Schumer started the practice in the mid-90s, so they've been there probably about 23 to 25 years.
Oh, long time. Lots of experience, lots of skills.
Yes.
Location, where are you located?
We are located at 240 West Cook Road in Mansfield.
Okay, talk to us about age range of the patients that ReVision LASIK has.
Well, typically patients come to us when they're old enough to have a vision correction procedure, LASIK, PRK, and so typically our patients start at 18 and go up from there.
Okay.
It just depends. We do have an optometrist, Dr. Mark Nolan, and he does see some general eye care of patients in their early to mid-teens and on up.
Okay. Do you have any idea the oldest patient that you have?
I think our oldest recently was 99 years old. He celebrated his birthday at our practice that day.
That's great.
Yeah.
Well, congratulations. Yeah. 99 years old. Okay, obviously ReVision is noted for its outstanding patient care. Talk to us about that care.
You know, I think what really sets ReVision apart from other practices is that we customize the experience. And it's not just the customized treatment plans, which certainly we do, but it's the personalization of the entire experience. From the time a patient calls, our first impressions team answers the phone and begins to collect information about the patient. And so it's a personalized experience for the individual, but also in the vision treatment plan. The doctors meet with them and we ask all the right questions to make sure that we are doing everything we can to customize the plan for vision for the rest of their life. So it's really about the individual, it's not just another doctor visit.
Okay, let me ask you a personal question that's not on the list, okay?
Yeah.
All right, now, normally they say that the people that we really don't like to go to is the dentist.
Sure.
Okay? Not my case. I don't mind the dentist at all. I just hate somebody fooling with my eyes. Make me comfortable.
You know, it's about the conversation. Again, it starts on the phone and then at the front desk. And it's not just a doctor visit. It's not just the transaction of getting your insurance card, getting your driver's license and all of your details.
Oh, yeah.
It's about talking to you as a person. Listening when you want to talk about your grandchildren or about the fact that you just got out of college, your sophomore year, and you're coming to see us on your summer break. It's really identifying and understanding the patient and the person that's coming in. And then you go see our technicians and they ask a lot of the same kind of questions, but we make people comfortable and we listen well. And so I think it's more the transformational aspect of the visit than it is just the transaction going through the motions.
So that's what makes ReVision different than other organizations.
It is. A lot of places it's about getting the patients through, just get them through, just get them through. Yeah. And with ReVision, it's really about creating this experience.
Well, I like that word custom.
Yes.
Talk to me about that again. You said it, but say it again to me. I mean, that rings true in my ear when you're talking about custom.
Well, there's for the doctors, it's absolutely customizing the treatment plan. So it's asking the questions, asking about the lifestyle. Do you like to golf? Do you play music? Do you like to vacation? Are you a reader? Do you spend most of your time on the computer? It's asking all of those questions to understand that when we do the vision correcting procedure, where does the vision need to be set? What's the most important thing to that person? But from the rest of our team perspective, it's again listening about what's going on in your life. What's important to you? Is it, okay, my near vision is struggling and I have this new grandbaby and I just want to see their face.
Sure.
You know, so it's really about collecting as much information as we can, but getting to know the individual.
Okay, let me tell you some personal things, okay?
Sure.
Oh, now, it's not on the list, so be careful,
That's okay.
all right?
Yeah.
I'm old.
I don't
Stick
believe
with
you.
me for just a moment, okay? Now, the point of it is, and I talked to the doctor about this, but I need to hear what you're going to tell me. Driving at night is becoming a challenge for me. One, driving at night when it's raining, that's a multiple choice, a multiple conflict, a multiple challenge in my life. What am I telling you? I got problems, huh?
Right. Yes. But they're problems we can solve. They're problems we can help you with.
Yeah.
And I would ask you, and our doctors would ask you, have you been diagnosed with a cataract? Have you seen your optometrist, and do you know if you have a cataract, or have you already had cataract surgery?
Okay.
So that's one of the questions.
Good questions.
And
yeah.
so then if you've already had cataract surgery, that indicates the need for potentially a different procedure. So
Okay.
it's really about understanding what you're struggling with and understanding what you need for your future treatment.
Okay, so a patient coming in for the first time, we need to take a break, but I need to ask this question real
Sure.
quickly. Is it really what I should do is write down, I should make a list of some deficits that I'm witnessing in my life with my sight?
That's a great idea, and it's a great idea to come with questions and to come with a list of what you're struggling with. But even if you don't have that list prepared, we will talk to you and find all those things
Great.
out from you.
So I'm counting on the expert to perform this
Absolutely.
task or ask the right questions.
Absolutely.
Hey, you're watching I Love My Job. We thank you very much for that. Once again, we're talking to Alissa Fairchild, and she is an administrator, again, with LASIK Cataract Surgery. It's ReVision right here in Mansfield, Ohio, located on Cook Road.
Yes.
We thank you very much for coming.
Thank
We'll be
you.
right back with more of I Love My Job. Don't go away. Hey, you're watching I Love My Job. We thank you for that very much. Alissa Fairchild, who we're talking to, an administrator with ReVision, of course, LASIK Cataract Surgery, right here in Mansfield on Cook Road, and lots of questions, and she's providing lots of answers. Because, again, one of the issues in our lives, one of the challenges in our life, of course, is our eyes, and as we grow older, and it doesn't necessarily have to be older. And of course, that's one of the great things about ReVision. You could be 18 years old.
You can be 18 years old or even younger. We do some general eye care for the teens. We don't specialize in pediatrics, and there's definitely doctors that do specialize in pediatric vision care because our vision changes as we grow and as we age. So there's so many different treatments for different age groups and different conditions or things that present as we get older.
Okay, now I've outlined for you just a couple of my issues in my life.
Yes.
I got tons more, but we don't have time for them tonight. Anyway.
We specialize in vision.
Okay, I gotcha. That's great. Okay, someone, again, watching, whether they're 18 years old or whether they're 99 years old, whatever the case may be, what are some of the signs? What tells me that I need to get to ReVision?
Well, if you're a younger person and you've worn glasses and contact lenses your whole life or throughout your childhood or your teenage years, and you struggle with that, you know, your younger people are active, they play sports. The millennial generation are definitely adventurers, and so they're doing a lot of things that they don't want to have to hassle with glasses and contact lenses. And so that's something we can help with. So that's one great reason to come to ReVision. Another is as we age, as we hit that magical 40s decade, the close-up vision tends to go away, and a condition called presbyopia sets in, and that's where the lens is less elastic and doesn't accommodate well, so it's more difficult to see distance and then close up. And so there are definitely treatment options for that. There are inlays, there's LASIK treatments, and then as we continue to age, if we all live long enough, we will get a cataract. And having a cataract is actually great news. We celebrate that at ReVision because
wait, say that again.
It's good news.
Good news.
Yeah.
Okay.
It's a great thing to have a cataract.
Explain that to me.
Because we can fix it. We can fix it.
Great.
And you can our surgeons replace the natural lens in the eye with an artificial lens. And a lot of people that have cataract surgery see better than they've seen ever in their entire life.
Okay, if I'm coming in for the first time, okay, we're going to paint by the numbers. You're going to paint for the numbers for me, okay? This journey. Give me the path that I'm going to take.
Okay. When you first come in, you will see someone on our first impressions team at the front desk as you arrive. They will get all of your information, and then our technicians will take you to testing, and we do a series of vision tests that give all the measurements for your eye. And there's many different factors that go into getting the proper measurements and getting all the information the doctor needs. Now that's all the technical information. Then once you see the doctor, after the technician completes all the testing, then the doctor will ask you many more questions about what you want your vision to be for the rest of your life, because these are life-changing procedures. They're not temporary fixes. They're vision forever. So once the doctor understands, then that's where the customized treatment plan comes in. So that's kind of the journey through the practice on our clinical side. And then after that, you would see one of our surgery educators, and they give you further details about what to know before surgery, what happens during surgery, and then your post-op treatment options or your post-op care. And then surgery day, we usually can schedule 1 to 2 weeks out typically, and you come in for surgery, and that is a day where you go into post-op, you see nurses, and you'll get some relaxation medication, and then you go in for your procedure, and most procedures last anywhere from 10 to 15 minutes for cataract or LASIK.
Oh, wow,
yes,
that's wonderful.
It's a quick procedure.
That's great.
And we have some amazing technology that makes it painless and makes it pretty quick.
Okay, Alissa's who we're talking to. Again, Alissa Fairchild, and she is with LASIK and cataract surgery. And we're talking about ReVision in Mansfield High, Upper Road. We're going to continue to talk to her because she has lots of answers to wonderful questions. Hey, welcome back to I Love My Job. Once again, I'm Doug Theaker. And gee, Merry Christmas, we're glad that you're here. You know, the wonderful thing about this program is not me. The wonderful thing about this program is people like this, Alissa Fairchild, because she is giving you information and education, you know, we really all need to know, and she makes it so simple when it's so technical. But again, at ReVision, LASIK cataract surgery, we're talking about a room or rooms full of professional people. And that's what's the great part about all of this.
Yes.
What if you were to look at some of the wonderful things or great things about your job, what would you say?
Oh, goodness. I love working with people, and so that's what we do all day. So we hire people that love to work with other people, compassionate people. Yes, they're technically trained, but they're also, like I said before, they're trained in the transformational part of the patient visit. And so we have all of the technical aspects, all of the testing, all of the numbers that we have to look at to make sure we're doing the right procedure for what the patient needs. But these are compassionate people, and they're people that really enjoy our patients that come in and love talking to them and hearing about their lives.
Okay, so you're part of the inner circle. Now you're part of the group.
Yes.
And you're witnessing these people. You're working with them every day. Mm-hmm. Now, one of the things that I don't want to say often, but we do hear is doctors not having bedside manners. ReVision? We
have the best doctors. We really do. They're very technically trained, but they aren't technical in their presentation. They're technical in what they do, but we also have doctors that care about people. So when you have leaders that truly care and leaders that absolutely love what they do, Dr. Schumer loves what he does. Mm-hmm. He is very passionate about vision, and it's a happy thing. He gets to make patients happy and people happy every single day.
Whoa! Ka-ching!
Because he sends them out of
Yeah.
there with new vision.
Yeah.
Dr. Shaw
Yeah.
gets to send people out with new vision.
Yeah.
And so it's a really happy thing. It's a happy specialty.
Yeah, it's great. How about misconceptions? What do people have that they don't?
I think one of the misconceptions is that surgery is painful. And so it's not painful. There's a lot of medication that goes into it that relaxes the patient, but also makes it so you don't feel a thing. Patients are awake for these procedures, and so
Wow.
yes, so it's a light anesthesia that the patient can cooperate and can follow direction from the surgeon, but it's not painful at all.
Okay. Okay, now, I realize you are an administrator. You're
Yes.
not the doctor.
Nope.
But let me tell you about an ad that I see on TV all the time, okay? They keep talking about dry eyes.
Yes.
ReVision?
Yes, we treat dry eye. We have many different ways to treat dry eye. We have different drops, there's different sprays, there's prescription medication, but we also do a procedure called IPL, and it's intense pulse laser on the skin, and it also treats dry eye.
Okay. Once again, we're talking to Alissa Fairchild. She's an administrator with ReVision. We're talking about, of course, LASIK Cataract surgery, and we're going to continue our conversation. Don't go away. Hey, you're watching I Love My Job, by golly, and we thank you very much for that. Once again, Alissa Fairchild is with us. She's an administrator, and great, we're talking about eyes, and oh my, how important that is, and you use great words, custom, and you're talking. Okay, we've gone through all of that. Let's talk about evaluation. Okay, I make an appointment, I'm coming in, what should I bring with me? I mentioned something about that list. What else?
Always bring your insurance card if you have insurance, and also your driver's license. And that's about it. Everything else we take care of.
Okay, simple procedure.
Yes.
Okay, now, what's the best? Make a phone call for an appointment, come in, what do you think?
You can call us. It's 1-800-475-2113, or contact us through revisionize.com, and you can request an appointment on our website.
Okay, now I'm coming in for the first time. Again, the wife is bringing me, she's sitting out in the car. How long should I tell her to wait till I'm through with the evaluation by the doctors?
You know, most appointments take upward of 1 to 2 hours, and that is the complete journey through the evaluation.
Okay, tell her to stay home then, and I'll drive.
Tell her to go shopping.
Okay. You're good. Okay, go ahead.
So you'll be there probably about 1 to 2 hours,
Okay.
and that includes all that time for testing, the conversation with the doctor, and then if you do schedule a procedure, the time with one of our surgery educators. So it's an involved process, but it's a one-time appointment to get to the point where you can schedule a procedure.
Okay, this evaluation piece now, and I was just kidding about the wife, but the point of it is, can I drive home after that, or should I have somebody bring me?
You know, it's good to have someone come with you for a couple
Okay.
of reasons. One, to drive you home, because we do dilate the eyes
Okay.
during that time. And while you can drive, it's just not comfortable because the eye is completely open, so the brightness can really bother you. And the close-up vision's affected, so seeing your instrument panel in your car can be difficult. So that's one good reason. The other reason is if you do schedule a procedure, you've gotten a lot of information during this visit, and so it's really good to have another set of ears, especially your wife.
Yeah, that's a great idea. Absolutely. Okay, now if the doctor recommends a procedure, cataract surgery, I got cataracts, okay? And they're going to remove those and replace them. And again, now, what can you give me a time frame on that?
To scheduling the appointment?
Yeah.
Usually it's 1 to 2 weeks. We can get somebody scheduled in 1 to 2 weeks.
That early?
That early. We have 2 surgeons and we have 2 surgery centers. We have the location in Mansfield and we do have a location in Columbus as well.
Okay.
Yeah.
And then again, once the procedure is over and I proceed home, I'm not going to stay there, of course. Again, I come back for what? Evaluations, reappointments? How does that procedure work?
After the procedure, you will have a post-operative appointment at 1 day, and that will typically be with ReVision. If you're referred by an optometrist, we have a great relationship with a lot of the optometrists in the area, and patients can go back to their optometrist for their follow-up care.
Okay. All right. Now, we've got, what do we got, Matt? We got some information, okay? And you're going to pop it up on the screen. Is that what you're telling me? Thank you very much. My time is up. How about that?
Oh,
Went
thank
quick,
you.
didn't it?
That was quick.
Yeah, and you did a great job.
Well, thank
That's
you.
wonderful.
Thanks.
Great. Okay.
That
I
wasn't
feel
too
a
hard.
great deal more comfortable now than I did before.
Good.
All because of you. Thank you very much. Make an appointment. All the information you saw on the bottom of your screen, you can call them, or I suppose you could just stop in, couldn't you?
Absolutely.
Absolutely.
Always
There we
welcome.
go. Hey, thanks for being with us. We'll be back next week for more of I Love My Job. Once again, we're providing you with education and information you need to know. And good night.